Hello, my name's Desiree, and we are here today to talk about a very important topic that's a rising concern in UAE and across the world. That's diabetes. We have three doctors here today with us who are going to help us discuss about diabetes management.
Hello, I'm Dr. Sheril, Neurologist at Aster Clinic, Al Mutina.
I'm Dr. Saleem Moopen, Ophthalmologist, Aster Mutina.
Hello everyone, I'm Dr. Arvind, Specialist Endocrinologist working at Aster Clinic, Mutina.
I would like to discuss about the most common misconceptions or myths about diabetes that you must have encountered in your daily practice.
The common myth surrounding around diabetes is not a serious disease. The reality is diabetes is a serious disease which not only uncontrols blood sugar levels but also damages other organs like eyes, heart, kidneys and livers in a long-term duration.
Okay, anything from you, doctor?
For the eyes, many patients think that diabetic eye checkup means glass checkup. So that is not the fact. You need to check diabetic effect in the retina. So that is behind the eye. So doctor have to put drops and dilate and check the retina. That's a must checkup for all diabetic patients. And many patients think if they are controlled diabetes, then diabetic eye effect will not happen. So that is also wrong. Many times duration is a fact. When the diabetes duration is long, diabetic retinopathy can still affect the eyes. So you need to regularly follow up for the diabetic retinopathy.
See, one misconception that I routinely find in my practice is many people think that just because their sugar levels are well managed, or because they have mild diabetes or starting stage of diabetes, they don't have diabetic neuropathy. So what I want to emphasize is that diabetic neuropathy can happen even at very mild level of diabetes. With well controlled sugars also it can happen, and some patients, when they are diagnosed with diabetes, at that stage itself they're already having an existing neuropathy.
Okay, thank you for sharing that. The next question is, how important is multidisciplinary approach in managing diabetes?
Yeah, multidisciplinary approach is very important. As we said just previously that all the organs will be affected in diabetes. So they have to regularly check up with cardiologist for their heart and maybe nephrologist for their kidney levels and also ophthalmologist for their eye problems.
Okay. What about you, doctor?
Yes, it is, as he mentioned, it is very important to check all organs because diabetes affects all organs. And especially eye, if you ask me, eye is the one organ you can view the inside of the eye with an ophthalmoscope. So it is a unique opportunity to check the vessels, whether diabetes is affected or not, without any invasive procedure. You can examine the retina and see whether the vessels are affected. If the vessels of the retina is affected, there is a chance that the vessels of the kidney and other organs also affected. So it's a multidisciplinary is the treatment for diabetes. It's a must for that.
Okay. We can go on to the next question. This is for endo. How do puberty and pregnancy influence diabetes management?
Pregnancy and puberty influences the blood glucose levels very significantly. In these life stages, generally there are significant hormonal changes happening. Especially in puberty, there is increase in levels of sex steroids and also growth hormone, which actually increases the insulin resistance. In patients, especially who are type 1 diabetes, they require higher levels of insulin requirement during these stages. And in pregnancy is also a unique stage, life stage, wherein there is increase in hormonal levels like progesterone and some other hormones which are secreted by placenta. They also similar to pubertal changes. They also increase their insulin resistance. So we have to manage accordingly and increase the insulin doses, or maybe in some patients we have to just manage by diet. If these things are done, then there will be lesser complications occurring in mothers and baby.
Okay, that's great. The next one is, what food most impacts blood sugar levels and how can they be optimized for insulin regulation?
Uh, yeah, food intake actually has a significant impact in increasing glucose levels. Normally, carbohydrates have a significant impact. They will increase the glucose levels after their feed. Uh, Especially carbohydrates like refined sugars or sugary foods like colas or candies, or maybe some type of aerated drinks. These will increase the spike in glucose levels. And instead of these type of carbohydrates, you have to concentrate on complex carbohydrates like whole grains and non-starchy vegetables and leafy vegetables also. And leaner protein are better than red meat. Actually, leaner proteins like chicken, turkey, these can be used. And fats and oils from vegetable source, seeds, olive oil actually impact glucose levels well, and also they benefit heart also.
Okay, that's great. What are the early signs of insulin resistance leading to type 2 diabetes?
Insulin resistance is an important factor for onset of diabetes, or maybe you can consider that it is the main factor which causes type 2 diabetes. Insulin resistance, when there are signs and symptoms which we can notice a lot before onset of type 2 diabetes. Generally, some people face increase in fatigue, or maybe increasing glucose levels after they feed, and in especially females, they will be noticing abnormal cycles also, and in severe insulin resistance, they may actually notice abnormal hair growth over their body. And there are some signs which are forerunners for diabetes, like a darkening of their neck, sometimes armpits also, and axillary area and groin also, and some skin tags in various parts of the body. These are the markers for insulin resistance.
Okay, amazing. Now we will go to neuro. There are 3 questions. One is, what is diabetic neuropathy and what are some early signs?
Okay, so neuropathy is damage to the nerves, and it is one of the most common complications that we see in diabetes. The symptoms of diabetic neuropathy will vary depending on the type of nerves that are getting involved. However, the most common symptoms that we see is either numbness, burning sensation, pins and needles in the feet. Along with this, the patient can also have other symptoms like loss of balance, swaying to either side when walking. You can have autonomic symptoms like giddiness, abnormal, sweating, palpitations, feeling easily full after eating. Okay, and it is very important to recognize these symptoms early and have a diagnosis, because otherwise, if allowed to progress, you can develop an advanced neuropathy, then develop leg ulcers which will not heal.
Next one, can diabetic neuropathy be reversed or cured with treatment?
Unfortunately, till date, there is no treatment that can cure diabetic neuropathy. There are a lot of supplements which have been tried with variable response, one such as alpha lipoic acid, which can give quite a lot of symptomatic relief for the patients.
Okay, great. Which treatment slow the progression of diabetic neuropathy?
So, in type 1 diabetes, that is the diabetes that happens in younger age in children, so there the progression of neuropathy depends on the blood sugar levels. Whereas in type 2 diabetes, which happens in older people, the progression of neuropathy is dependent not only on the blood sugars, it also depends on the cholesterol, it depends on obesity, smoking, and even the blood pressure. So, along with controlling the blood sugar, it is also very important to manage the patient's cholesterol levels, reduce weight, reduce BP, stop smoking. And another thing is, we always emphasize that once you're diagnosed with diabetic neuropathy, you should examine your feet daily. And if you notice any minor injuries, it is important that to get it checked out with the doctor.
Now the next question is for ophthalmologist. What is diabetic retinopathy and how does it affect vision?
Yeah, diabetic retinopathy is an eye condition seen in diabetic patients. So what diabetes retinopathy? Retina means the nerve of the eye. It is in the back side of the eye, retina. So diabetic retinopathy is seen in all diabetic patients affecting the retinal nerves. When the retinal nerves start bleeding, it goes to various stages and affect vision. So important thing to remember is diabetic retinopathy can cause blindness. In the world, it is the third most prevalent reversible blindness, preventable blindness. And in UAE, about 20 to 25% of the diabetic patients has diabetic retinopathy. And in a study, they have found that 70% of the people are not aware of it. So it is important to regularly check. Once in a year, a dilated retina checkup is important to identify diabetic retinopathy.
What lifestyle changes can help prevent diabetic eye diseases?
No, there is no magic cure for diabetes. It is as these doctors said, you have to control diabetes, you have to quit smoking, control cholesterol, daily regular exercise. All these conditions affect the diabetic retinopathy. But another misconception is diabetic retinopathy. Doctor, my diabetes is controlled, so I cannot have any problem. No, it is not that. There are other factors like duration. If the diabetes duration is more, you can get diabetic retinopathy. And genetic factors. You're somebody in the family has diabetic retinopathy, you have a more chance to get diabetic retinopathy. So to prevent it, you have to change your lifestyle, a disciplined lifestyle, controlling diabetes constantly, not like spiking, one day going up, one day going down. No, it should be controlled fully, and other exercises, all these things important.
Great. Last question. What aids are available for those experiencing vision loss from diabetic retinopathy?
Diabetic retinopathy has no cure. Like diabetes has no cure. So diabetic retinopathy, if you find out it earlier, you can change. If patient knows that there is diabetic retinopathy, you can make controlling the diabetes more strict, and you can take some medication like vitamins, all those to slow down the diabetic retinopathy. But if the diabetic retinopathy has started and it is in a stage, then the treatment goes to vitreous injection, laser, all these treatments. This treatment is to control or prevent the blindness, but not to cure. If the patient after the treatment don't control diabetes, it can come back again. So it is not that like diabetic retinopathy is cured, I am free of diabetic retinopathy. So you need to still control the diabetes and continuously check and monitor.
Okay, that's great. That's all the questions for now. Do we have anything else that you would like to add? Anything that will help you think? Obviously, you have patients come in, like I'm sure a lot of patients come with diabetes concerns.
In ophthalmology, many patients think diabetic eye checkup means glass checkup. They want, doctor, I want to check the glass, I can see. That is not the diabetic checkup. Diabetic checkup is the retina checkup. Patient has to come early and put drops to dilate and see the back side of the eye. That is the diabetic checkup. And checking the pressure of the eyes. Diabetic patients are more prone to a disease called glaucoma, eye pressure increasing.
Yeah.
So we need to check that. These are the two things for diabetic checkup. So patient has to come prepared for that. When you put the drops and dilate, his vision will be blurry for 2-3 hours. He has to come with a person to drive back. He cannot come like and doctor, I cannot see anything, I cannot drive back home.
Yeah.
So that kind of a situation can come. So this is a checkup you have to do every year thoroughly.
And do you all see like a rise in the number of patients coming in? Because I was just checking and UAE is one of the highest. It's 19% of people here that are diagnosed with diabetes. So do you all see like a trend of rise in the recent years?
We have been here since 1 year. Actually, I have seen an increase, a mild increase in diabetic patients around as per literature or studies in UAE. Actually, it is It is around 30% of the total population are diabetic over here. And compared to the world, it is around 20%. So it is 10% more in UAE as per the latest literature.
If you have any further queries, you can book an appointment with me on the My Aster app.